COVID-19 complications. Sodium levels risk factor. Patients hospitalized with COVID-19 may have a poorer prognosis if they have abnormal sodium levels. The study shows for the first time that patients presenting at the hospital with COVID-19 and low sodium are twice as likely to need intubation or other means of advanced breathing support as those with normal sodium. This video is brought to you by HealthyRN Ways. Videos will be posted every Monday, Wednesday and Friday about the COVID-19 pandemic from the start of the illness and the other complications. Please see my other videos about COVID-19 pandemic. To watch the videos, see the end screen and end card at the end of this video. As the COVID-19 pandemic progresses, more and more complications are being discovered from the symptoms, blood test and other related diagnostics procedure. More studies are being conducted around the world. The study's findings showed that hospitalized COVID-19 patients with high sodium levels, hyponatremia, had almost a threefold risk of dying. Patients with low sodium levels, hyponatremia, were twice as likely to have respiratory failure. The authors of the study suggest that looking at sodium levels could help healthcare providers identify which COVID-19 patients are at the most risk for poor outcomes. How does COVID-19 change sodium levels? The balance of sodium and water is needed to maintain a healthy body. The body's sodium levels are regulated by the antidiuretic hormone vasopressin, which is released from the posterior pituitary gland in the brain. Antidiuretic hormones help control the amount of water being filtered out through the kidneys. There is evidence that a COVID-19 infection could disrupt this process. About 30% of individuals experience low sodium levels when experiencing pneumonia. Low sodium levels can cause a condition called syndrome of inappropriate antidiuretic hormone secretion, SIADH, where an inappropriate amount of antidiuretic hormone is released in the body. SIADH is commonly observed in patients in the hospital with pneumonia. SIADH symptoms include weakness, fatigue, dizziness, nausea, and in rare cases, it may also cause seizures. In severe hyponatremia, there's also a risk of cerebral edema and death. Some research has suggested that coronavirus-induced pneumonia is linked to low sodium levels. A June 2020 study documented a case of a hospitalized patient that had hyponatremia from pneumonia during a COVID-19 infection. The patient was later diagnosed with SIADH. Another study, in June 2020 in the journal Endocrinology and Metabolism, reported 3 cases of COVID-19 patients ranging in age from 20 to 58 years old who had fever, pneumonia, and severe hyponatremia. About 1/3 of hospitalized patients for COVID-19 will have low sodium levels. COVID-19-induced pneumonia that causes SIADH could be triggered by an immunological condition. The interleukin-6, a cytokine associated with increased inflammation in COVID-19 infection, could be the culprit. The increase in cytokines can result in SIADH via IL-6 directly stimulating the non-osmotic release of antidiuretic hormones, or due to injury of lung tissue and alveolar cells, which can induce SIADH via the hypoxic pulmonary vasoconstriction pathway. The researchers with a median age of 68 years who had been diagnosed with COVID-19 and were admitted to either the UCL hospital or the Whittington Hospital between February and May 2020. The hospital's total mortality rate was 31%, with patients dying at a median of 7 days after they were admitted. The patients who survived stayed in the hospital for a median of 8 days. The majority of patients had another chronic medical condition, the most common being hypertension, diabetes, and chronic kidney disease. Incidence of abnormal sodium levels: 5% of patients had high sodium levels when they were admitted to the hospital compared to 24% of patients who arrived with low sodium levels. About 18% had mildly low sodium levels, and 6% had moderate to severely low sodium levels. Only 19% of patients showing severely abnormal sodium levels were tested for hyponatremia. Hypovolemic hyponatremia, a condition where the amount of sodium in the body is greater than the total amount of water in the body, was diagnosed in 75% of patients. Abnormal sodium levels linked to mortality rate. The study's findings showed that high sodium levels were associated with a 46% risk of dying in the hospital. This was followed by a 30% mortality for patients with low sodium levels. People with normal sodium levels showed a 28% mortality risk. Treatment to correct the sodium imbalance made no difference to patients' mortality risk. Having high sodium levels in the first 5 days of hospitalization, being of older age, and having higher C-reactive protein concentrations, a marker for inflammation, were also associated with dying in the hospital. The researchers also found that having high sodium levels on the 3rd and 6th day of hospitalization was most closely linked to mortality. Effects of abnormal sodium levels on hospitalization stay. The sodium and urea levels appeared to increase in all patients during their hospital stay. High sodium levels increased from 5% during hospital admission to 13% after 5 days. The chances of patients having low sodium levels were reduced from 24% to 14% during this time. The patients whose sodium levels increased while they were in the hospital were more likely to die after 5 days. Patients who did not survive had a 29% rate of high sodium levels compared to a rate of 5% in patients who did survive. Low sodium levels may predict respiratory failure. About 100 patients needed breathing assistance, 51 required a CPAP machine, 25 needed to be placed on a ventilator, and 24 patients needed both devices. About 31% of the patients with low sodium levels needed to be on respiratory ventilators compared to 17% of the patients with normal sodium levels and 7% of the patients with high sodium levels. The authors of the study suggest that having low sodium levels is associated with a twofold increase in needing respiratory support. The sodium measurements can inform doctors about which COVID-19 patients are at high risk of deterioration and death, and can guide decision-making about whether a COVID-19 patient needs hospital admission or monitoring in the intensive care unit. Monitoring sodium levels and reducing risk. Any person with COVID-19 is at risk of developing a sodium or electrolyte balance. However, the risk is greater for older people, people with comorbidities, and people who are dehydrated. With regard to COVID-19 treatment, healthcare professionals need to treat the conditions causing SIADH, as most mortality rates from COVID-19 are not related to SIADH but rather from pneumonia and organ failure affecting the lungs, heart, and kidneys. However, it's essential for doctors to monitor sodium levels and perform blood testing if a patient is experiencing SIADH symptoms. To manage sodium levels, Siddiqui recommends that people drink water and water with electrolytes to avoid becoming dehydrated. Having COVID-19 can cause abnormal sodium levels. For hospitalized COVID patients, these abnormal levels can lead to a higher risk of complications, including death. If you are sick, it's important to stay hydrated. Drinking water with electrolytes can help maintain a water-sodium balance in your body. If you experience weakness, fatigue, and nausea, contact your healthcare provider to have your sodium levels checked. Key takeaways: patients who are hospitalized with COVID-19 may have changes in the level of sodium in their blood. According to a new study, hospitalized COVID-19 patients with high sodium levels have a threefold increase of dying. Low sodium levels were associated with an increased need for a respiratory ventilator. The authors of the study suggest that healthcare professionals use sodium levels to assess a patient's mortality risk. Sodium is an electrolyte in the body. Electrolytes carry an electrical charge, and they assist the body in maintaining fluid levels inside and outside of the cells and in the blood. Sodium is crucial for your cells to be able to function properly. Your body ingests most of its sodium in the foods that you eat, and it loses sodium through sweating and urinating. But sometimes, circumstances such as illness, diseases of the kidneys, taking medications, such as diuretics or steroids, consuming too much or too little salt, receiving IV fluids, and more can throw your sodium levels out of whack. Some of the more common symptoms of low sodium hyponatremia include lethargy or fatigue, confusion or disorientation, muscle twitching or muscle cramps, difficulty walking, seizures, coma. The symptoms of too much sodium, hyponatremia, can be similar to those when the sodium levels are decreased. One main difference, however, is that elevated levels may cause a person to feel especially thirsty. If your healthcare provider suspects there may be an imbalance in your sodium levels, they will order a sodium blood test. The sodium test may also be referred to as Na test. Na is the periodic symbol for sodium. Purpose of the test: the use of a sodium test is to determine whether your levels are too low or too high, both of which can cause a variety of symptoms ranging from moderate to severe. It's not uncommon for a sodium test to be done as part of a metabolic panel, which measures other electrolytes like potassium, chloride, and bicarbonate. The test will help your doctor better understand the amount of sodium in your blood and what may be the factors causing you to feel unwell. Risk and contraindications: like most blood tests, the risks and contraindications associated with a sodium test are considered slight. Blood tests have a low risk of complications. However, one area where you might feel some mild discomfort is when a technician or nurse attempts to draw your blood. A technician may discover that some people have more challenging veins from which to take a blood sample. Consequently, the technician will likely need to insert the needle more than one time, and that process can cause a bit of pain, but only temporarily. Additional problems that could occur during a sodium blood test include a stinging sensation or minor bruising at the site of the insertion, a feeling of faintness or lightheadedness, blood collecting under the skin, called a hematoma, bleeding, swelling of the vein, called phlebitis, infection, though the risk is low. Note that most of the above symptoms disappear quickly, usually within a day or two. Also, some medications, like diuretics, antidepressants, and others, may alter your sodium levels. Let your doctor know about all the drugs you're taking, including over-the-counter medications and supplements. Depending on your situation, your doctor might ask you to change your medication schedule for a few days before the test for the most accurate results. Typically, there are no specific preparations required to have this blood test. You should be finished with the test itself in a couple of minutes. The test may take place in your doctor's office or in another outside facility that conducts blood work. For clothing, you can wear your usual attire. However, to allow for easy access to your veins, you may choose to wear a shirt that has sleeves you can roll up. Food and drink: if your healthcare provider is doing other blood tests at the same time, you might be asked to fast for several hours before the test, often overnight. Cost and insurance: on the day of the test, have your insurance card and a form of identification handy so that your blood work can be billed to your insurance carrier. Before the test, you may want to talk with your insurance company about whether or not the test requires pre-approval or what your out-of-pocket expense might be. Many blood tests done in a similar manner, so if you've had your blood taken before, this process will be more or less the same. First, you'll likely be seated in a chair so that you can rest the arm from where the blood will be taken. The technician or nurse will place an elastic band around your arm to temporarily restrict the flow of blood and locate a vein. Once they have found the vein, they will disinfect the area using an alcohol swab or pad, then insert the needle. After the needle has been inserted into the vein, the technician will place a small tube at the end of the syringe to collect the sample. When a sufficient amount of blood has been obtained, the technician will remove the elastic and place an adhesive or bandage over the insertion site. After the blood tests of this kind are very normal, uneventful procedures. If you notice a bit of pain at the injection site, it should go away in a few days. To prevent bruising, your technician may recommend that you keep the bandage on for a few hours to decrease the likelihood of this happening. Most of the time, there is little to no follow-up instructions after a sodium test, and you're able to resume your regular activities. Your healthcare provider should notify you once the results are back and provide you with any specific follow-up instructions you might need. Results: if your sodium levels are elevated, it could suggest problems with the adrenal glands, kidneys, significant fluid loss, diabetes insipidus, and more. If your sodium levels are decreased, you may be showing signs and symptoms of dehydration, overuse of medications like diuretics, Addison's disease, heart issues, and certain kidney and liver diseases. Be sure to discuss the results of your test thoroughly with your doctor or healthcare provider. In the event you do have one of these underlying conditions, early treatment is key. If your test results fall outside the normal range, your doctor will help you determine the cause. Keep in mind that changes in sodium levels don't always indicate an illness. They may fluctuate due to other factors such as the medications you're taking. Be sure to talk to your doctor if you have questions or concerns regarding this test. Do you have any comments and suggestion? Like and share to my channel. To see my other channel on the race to COVID-19 vaccine at the end card of this video. Thank you for watching. See you on my next video. Mabuhay.